classify gout. Gout can be primary or secondary. Okay, what do you mean by primary? Primary is due to enzyme deficiency. So primary is mainly due to enzyme deficiency. What do you mean by enzyme? Which enzyme deficient will lead to the gout pathophysiology? It is HGPRT. That is hypoxanthine guanine phosphoribosyl transferase. This enzyme deficiency, actually this enzyme helps in breakdown of the purines into other metabolites. When this enzyme is deficient, most of the purines will get converted into uric acid, which will lead to elevated plasma levels of uric acid in the blood levels of the patient. So this enzyme deficiency is the primary cause. This can be either partial or it can be complete deficiency. Partial deficiency, we have no problem. The person might have acute attacks of gout on and off. So if the person has complete HGPRT deficiency, it is known as the Lesch-Nyhan syndrome. Lesch-Nyhan syndrome. Okay, mostly the patients suffering from Lesch-Nyhan syndrome will have more CNS manifestations compared to the gout. So these are the primary causes of gout. When it comes to secondary causes will tell when there is increased cell turnover. So whenever there is increased cell turnover, we see elevated levels of nucleic acid in the blood, and these elevated levels of nucleic acid, that is of course the purines, are converted into uric acid, and this elevated uric acid leads to gout. So the secondary causes are leukemia, lymphoma, and polycythemia. And what happens in this? There is increased cell turnover. Increased cell turnover, which leads to increased nucleic acid synthesis and further increased breakdown of purines into uric acid. So this leads to gout in the secondary cases of leukemia, lymphoma, and polycythemia. It can also be due to drug induced. What are the drugs that lead to hyperuricemia? These are nothing but as thiazides. So these drugs basically inhibit the uric acid excretion in through the renal system. It could be furosemide, it could be pyrazinamide, or other drugs such as ethambutol as well as levodopa as well. So these are the drug induced secondary causes of hyperuricemia. So these are the basic classification of gout. Alright.